mast cell tumor, which isn't that interesting in and of itself, but its location is going to be challenging. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So the issue here is we've got this, so this is the pinna of the ear here. We've got this mast cell tumor sitting right here, which appears to be sub-Q, which is in its favor because sub-Q mast cell tumors have a lower metastatic rate than cutaneous mast cell tumors overall. And then we have to consider the vessels that supply the pinna, and so we have to be careful not to damage all three of those vessels. So we have the medial, the intermediate, and the lateral auricular vessels here. I'm pretty sure I'm going to have to sacrifice the intermediate, maybe the medial, and we'll just have to see how we go. So mast cell tumor is sitting here, so I'm going to start my dissection with a margin of, I've done a CT scan, so it's fairly discrete, and so I'll start my incision up here. I'm going to go through some muscle layers, which are going to provide my deep margin. All right, and so just started my incision using a blade, and then I'm going to start coming through with electric cautery. I might get Mel to retract medially here. Yeah, just gonna maybe grab that. I'll grab another one as well. All right, so now if I'm concerned about my margins during the surgery, I may do electric chemotherapy. If we send it off and find out that our margins are incomplete, we may come back and do electric chemotherapy later on. Just give me some retraction back there. Go through these muscles here as well. If you have a minute, let us know where you're watching from. I'm trying to keep a wide margin, particularly deep. Now, if we do get necrosis of the pinna, we may have to come back and amputate that in the future. So my caudal marginal vessel appears to be still intact, which is good. Because it is a kind of an arcuate vessel. Some down to cartilage there. I have had one cat develop necrosis of the pinna after, can I get a number 4 Gelpy, please? After a total ear canal ablation, and that cat did have diabetes, and so I think that it probably had some peripheral vascular disease, which contributed.
One for now.
All right, so this is one of those auricular vessels there. I see that there's a question there about a perineal hepatoid adenoma. I'll get to that maybe when I'm finished. No, I'm not really meant to do this, cut skin with scissors, but I just think it's going to be easier for me to control my cut. Maybe not. Okay, so I feel really good about what we've done here in our margins, and so we've got a muscle belly deep to it. The risk here really is going to be if there's damage to all of the marginal vessels, in which case we may have issues with necrosis of the pinna. I don't think these owners would be too concerned if we had to do a pinna amputation. The referring vet is one of our former interns, and he was a good surgeon. So he would be able to do that without having it having to come back to us. All right, so that's going to close primarily, I reckon. Can I get some Pivocaine, please?
Do you want the full liquid?
Yes, please. See if I can move the camera over a little bit. And zoom in a little bit. So you can see that defect that we've created there. So does perineal hepatoid adenoma respond to topical tacrolimus and finasteride orally rather than castration? I don't know. I don't know the answer to that. My tendency is to say that it probably would respond, but you know, hypertension to go into surgery, I don't think should be a reason not to. I think you can probably control that hypertension using medication. And so recommendation would probably be to go ahead and remove it if you can. And it's good to see that we're getting some bleeding out here on the periphery. That means that we've got some collateral blood supply coming in. I think I'm going to close it like a Mercedes-Benz sign. I'm just doing a splash block of mepivacaine. And then just doing an injection around the outside. Can I get some OPDS, please? I'll just use the bigger needle drivers. Like this big needle so we don't spring the needle drivers. All right, so what I'm going to do here, I think that this will come together like this, and that'll come up like this. So let me just see if I can get some deep subcutaneous sutures just to provide some support. And his ear may be a little bit erect, but I don't think these owners are concerned as long as he's or she is cured of the tumor. Hi, Connecticut. Saw Egypt back there, and India and Toronto. I'm not going to ligate that. I just perforated a little vessel, and I'm just going to hold that off rather than ligate it because I don't want to disrupt our blood supply. So I've got a few minutes here if you guys have any more questions. Can you scroll backwards just with your finger and see if there are other questions that I've missed? Paradise, California, Costa Rica, Utah. Yeah, so using the electric cautery definitely accelerates my surgery time without, 100% without a doubt. Hi, Gainesville. I'm a Gator as well. I went to University of Florida, graduated in 1990. Las Vegas, Toronto. It's like a cyst removal and a pimple popping video is not quite. A little bit more involved. Canada, 5:30 a.m. in Egypt now. So a little bit of oozing, but I'm not going to tie off that vessel. Massachusetts. Yeah, so I'm using O-suture because of the biomechanical stresses. Virginia, I also lived in Virginia for a long time. I lived in Virginia for about 10 years. All right, so I'll see if I can, I might get you to hold that off. And the other thing is that this is a 52-kilo dog. So he is going to put a lot of stress with this big floppy ear. All right, so let's see what we've got here. So just as a review, sub-Q mast cell tumors overall have a better prognosis than cutaneous ones because their metastatic rate is only about 15% overall compared to cutaneous mast cell tumors where the metastatic rate ranges from 5% to virtually 100% depending on the grade of the tumor. So if you can choose one, you'd rather a sub-Q. Sarah Austin, our chief resident, is repairing a pretty nasty, very proximal radial fracture next door. I'm watching her through the window. I think things are going well. She's little, but she's tough, Sarah. Interesting to put a pulse ox on this ear and make sure that we've got a pulse wave. I'm sure it's going to be fine because I've got bleeding from the edges here. And so I'm intentionally not going too deep with these sutures. Can I get some more O, please? Thank you. Are you happy to do an intradermal on this? I will probably not put any kind of bandage on this. And then there's a question about who decides, or how do we decide who does which surgery. Part of it comes down to who sees the original consult. So usually, like most of our surgeries here, most of our surgeons can do. And so it just comes down to who sees the case. And sometimes there'll be clients that specifically want to see me, for example, or James, for example, you know, and the other thing is that we have areas of expertise. So I do a lot of the intrahepatic shunts. We also have Stuart Ryan who does intrahepatic shunts here. I don't think anybody else is trained to do them. And like some of the bigger cancer cases come to me. I tend not to do the big complicated orthopedic cases, just as a matter of personal preference. And so it is kind of a mixed bag about how cases are assigned between our different surgeons. All right, I'll leave that to you. All right, so I'll just come around and make sure there aren't any questions I haven't answered. There's a comment, ortho is scary. I agree. So somebody commented that there was no streaming for a long time. I've been in and out of clinic, to be honest with you, and it's been variably busy. And so, yeah, so we can only stream what we have available to us. I would not expect a near hematoma. Somebody had a similar surgery, similar mast cell tumor in this location that had an eye lift after surgery. And that's pretty much it. So I'm not going to make Mel live stream her closure. So I'll go ahead and wrap it up now, but I'm hoping to live stream something else again today. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So let me just make sure I haven't missed anything.